Welcome to the offices and showrooms of Henry Schein. We thought we'd put a few videos together to show you what you need to do to prepare your practice for our startup after a period of time that the practice has been closed down. Your practice may need to go into shutdown because of COVID-19, and if so, there's procedures that you should do with all your equipment. So whether it's your chair, your autoclave, your compressor, your suction motors, or your ancillary equipment, all of them need to go through a process of shutdown so that when it comes to startup, the equipment is ready to start up and it's not going to fail. So I'm going to hand over to John Rice, who is our service manager and equipment specialist, to talk through what procedures you need to do.
Okay, so if we work on the standard chair, we're lucky here we're using a brand new Anthos R7, which is a nice clean chair. You're going to be working in your surgery and with equipment that has been used over a period of time. Important thing to remember for yourself is you will be working on parts of the equipment that has been contaminated through normal usage, so it's important that you remember to wear the correct PPE, remember to wear a mask and a visor as well when you're working on it. All chairs have basically the same components. We have a delivery system, we have our chair, we have a cuspidor, and we have an assistance element. We'll break it down into small bite-sized chunks so you can just focus on one part at a time. We'll start with the delivery system, and we'll start with the delivery system because the most important part of your delivery system is the dental unit water lines. We're all aware of the problems with biofilm over the years and how it builds up in the systems, and in most cases surgeries are using a system for cleaning the dental unit water lines, but if your unit is going into storage or going into shutdown for a period of time, then there's an upgraded procedure that needs to be followed. If you have a unit that has a built-in disinfection system, then get your manufacturer's recommended procedures out and follow them for a deep clean, sanitation, as it's called for Sorona, and follow that procedure clinically, line by line, until you've completed all the procedure. Put the unit into shutdown, leave it. When you come back in, you will have a procedure to follow again to clean the unit after sanitization and allow you to use it safely on your patients. If you have a water bottle, then it's important that you follow the instructions on the product you're using. They will be different for each product. Some products allow you to leave them in the system for a period of time. If you're using Bilpon, it can be left in the system for up to 3 months. If you're using some of the other cleaning solutions, then they have to be washed out after cleaning disinfection, and then the unit run dry so that it's safe to put it in. So a basic procedure would be you take your bottle up from your system, dilute the solution to the correct level and put it into your bottle. You then take all your handpieces lines, all your handpiece lines, 3-in-1 syringe, and you can do it into the spittoon bowl. You run them until you have the solution that you put into the bottle running through the lines. You then can hang up your instruments, and depending on what you're using, it will have a contact time that it needs to be in the system. Some are an hour, some are 24 hours. As I say, with some of them you can leave it in for 3 months. Whatever it needs to be, you need to note that. Easiest thing, piece of paper on the desk, solution applied at a certain time, needs to be removed at a certain time, and remember that and make sure you come back in. On the delivery system, there's not much else you need to do. What I would recommend is, before you run any heavy duty cleaning solutions through, you take off any couplings or any high-speed turbines that you have on the unit, take the tips out of any scalers that you have built into the unit. The reason for that is if there's a biofilm runs through, then it doesn't get caught in the smaller tubes. The handpiece tubes and the syringes and the electric micromotors and air motors, they actually have larger bore tubes, so they don't get as badly affected. I say keep an eye on the contact time and make sure you follow that through and work with the manufacturer's recommendations. If you have something which is a short-acting product, you need to run through the fluid that's out in the bottle, make sure it all empties, get some clean water into it, run it through again until there's nothing but water coming through your water lines. Run your bottle until it's totally dry then afterwards, and make sure all your lines, including your 3-in-1 syringe, your high speed, your slow speed and your scalers, are all running without water, they're just running dry. Take the bottle off the unit, take it to the side, turn it upside down and let it drain, and just leave it like that for the period of time.